we left off talking about the bronchial tree and said that alveoli are the little air sacs that are hanging off our respiratory bronchioles and is the site of gas exchange. So our alveoli are going to be closely associated with a capillary, and gas exchange is going to occur across this membrane we call the respiratory membrane. So the respiratory membrane has three parts, and this is the surface across which gas exchange occurs. So the three parts are the endothelium of a capillary, the simple squamous layer of our alveoli, so our simple squamous epithelium of the alveoli, and then the basement membrane that they share. So all of our epithelial tissues are grounded to a basement membrane. So that would be the third component of the respiratory membrane, is the basement membrane that both of these layers share. And gas exchange is going to occur across this respiratory membrane. So there will be a basement membrane in between here, and if these cells are the cells of our capillary, we would have an erythrocyte running through here. These green cells are the cells of our alveoli. Then we've got air in here. And how gas exchange is going to work at the level of the lungs is oxygen is going to leave the alveoli and enter the blood, and CO2 is going to leave the blood and enter the alveoli. I briefly mentioned that we had type 1 and type 2 alveolar cells. Type 1 cells are the simple squamous cells that make up the wall of the alveoli. The second type, type 2 alveolar cells, some folks call them great alveolar cells. These have the important job of creating this detergent-like substance called surfactant. And the job of surfactant is to increase the surface tension of the alveoli so that they don't collapse on exhalation. So all of our respiratory structures are covered in mucus, so it's a wet system. If you had pressure changing and our pressure dropping and there wasn't surfactant in there, then your alveoli would collapse together and stick together, and it would be hard then to get them open for the next breath. So surfactant is going to fill the alveoli so that they've got a high surface tension and don't collapse upon exhalation. So this is the problem with premature babies before 36 weeks of gestation. Their lungs are not producing surfactant. So that's why they want, if you go into preterm labor, they want to put you on medicine to try and keep you out of labor until 36 weeks when the baby's lungs start making surfactant. The last part of anatomy that we need to talk about are the differences in the lungs. We briefly addressed this as well, but we've got a left and a right lung that are different. They sit with their base. The base of the lung rests upon the diaphragm. The diaphragm is our primary muscle of respiration. We've got other muscles that can be contracted or exercised if we want to do forced inhalation or exhalation, but for normal set pace of breathing, the diaphragm is your main muscle of respiration. So it's going to poke into the base of the lungs. The apex of the lungs is this surface up here that will kind of just barely come above the clavicle. If we look at our right lung has three lobes, a superior, middle, and an inferior lobe. And our left lung just has two lobes, and it's got this region called the cardiac notch. So this figure in your book shows you our different lungs and their differences. This area here, that's where we've got like this indentation, is called the hilum, and in the hilum a root of each lung is going to enter. So the root of your lung has a couple things. It's got a main bronchus, it's got pulmonary, a branch of your pulmonary artery, your pulmonary veins, nerves that serve the lungs, and lymphatics that serve the lungs. So the root is going to penetrate the lung and bring all of those important structures into it. Those are the most important parts of the gross anatomy of the lungs that you need to be aware of. As far as our pulmonary circulation goes, we've already talked about this when we talked about the circulatory system. So our pulmonary arteries are going to be bringing deoxygenated blood into the lungs. They are going to branch into our lobar arteries that are going to serve a specific lobe, that branch into segmental arteries. Ultimately, we're going to get down to pulmonary arterioles. We'll have gas exchange occur, so that oxygenated blood will be picked up in pulmonary venules. The pulmonary venules will become bigger and bigger veins that ultimately become the pulmonary veins that bring the blood back to the heart. All right, so now we can talk about physiology. So first, when thinking of physiology, we should think of the functions of the respiratory system, and then we'll go through the specific mechanics of breathing and the pressures that are involved. So as far as the functions go, the respiratory system provides first an air passageway. So it's going to conduct air from the external environment into the body and back out. Second function is it's going to give us a site for gas exchange. At the level of the lungs, O2 will enter the blood and CO2 will exit. So those are probably the most important functions of the respiratory system. Some other secondary functions are that it helps with the detection of odors. So as you're smelling something, you tend to, if you're really trying to smell something, you'll sniff it up to your superior nasal concha where we have that olfactory epithelium. So it's going to help it brings in our odorant molecules, suspends them in mucus because our olfactory receptors are chemoreceptors. So we've got to suspend those odorants in mucus so that we can then detect them with those receptors. Say that the olfactory epithelium is located at the superior nasal concha. And then the last kind of secondary function of the respiratory system is that it's going to help with the production of sound. As we vibrate or manipulate the air through those vocal folds, it will help with the production of sound. What are the mechanics of breathing? So really, to talk about respiration, we need to worry about a couple different types of pressures. So first we'll say respiration is a four-part process by which we bring our air into the body, have gas exchange at the lungs, transport that gas to the tissues, and have gas exchange at the level of tissues. So respiration involves more than just breathing, so we're going to have to know all of the steps, but respiration is getting the air from the environment into the body to the tissues and back out. So in order for respiration to occur, we have to be aware of a couple different types of pressures and some laws that guide the behavior of gases. I'm not going to make you worry about the specific names of all of our laws. You can take a physics class and talk about all that stuff. But we do have to have a general understanding of how pressures work in order to understand what's going on in the system. So gases move from an area of high pressure to an area of low pressure. So that's the first thing to be aware of, is that gases will move from an area of high pressure to an area of low pressure. The other law to be aware of is going to determine how gases behave with changing volumes in a system. So as the volume on a gas increases, the pressure on that gas decreases, and vice versa. We can also say then, as the volume on a gas, or holding a gas, that's maybe a better way to say it, decreases, the pressure on that gas will increase. So let's look at this and imagine a closed system where we can't let the air out, and then we'll talk about how the different pressures in the system so we can understand what happens during breathing. So let's say we've just got this container, and it's a closed system, so the gas that's in here has nowhere to go. It's got 100% of the gas that it can hold, and in the bottom of this container we've got a plunger. So I can start pushing on this plunger, and as I decrease the volume, now I'm increasing the pressure on this gas. So as I push up on this plunger, I'm giving there less volume to the container. Now this 100% of gas has to move up. So this is increasing the pressure as we're decreasing the volume. The opposite is also true. So now I start pulling down on this plunger, and I increase my volume, and now there's less pressure on that gas that was in there. So our pressure is going to drop as our volume increases, and I can do that until I get back down to 100% of my volume. So just kind of be aware of that. These are the two laws that we're going to be concerned about. And now let's talk about the different pressures in the system. So the first pressure is what's called intrapleural pressure. This isn't going to change a lot from moment to moment. So if you look at the lungs, they've got a pleural cavity, and the pleural cavity is created by that potential space between our visceral and parietal pleura. So all of our organs have serous membranes. The serous membranes of the lungs are pleural membranes, and the pressure in between the visceral and parietal pleura is what's called our pleural pressure. So if you look in this little space, this is our pleural cavity, and the pressure here is called intrapleural pressure. It's a negative pressure, so it keeps the lungs inflated. So this is negative pressure. That keeps lungs inflated. So if you break a rib and you puncture a lung, your lung is not collapsing because of anything that's happened to the lungs. Your lung is collapsing because you've ruptured that pleural membrane, and now we don't have this negative pressure keeping the lungs inflated. So it's going to change our respiratory cycle, intrapleural pressure, but it's changing with intrapulmonary pressure. So it's not significant as a pressure change throughout the respiratory cycle. So we'll talk more about that in just a minute. But just be aware that that's the pressure caused by the pleural membrane, and it's keeping the lungs inflated. All right, so for respiration, our first step in respiration is what's called pulmonary ventilation. And pulmonary ventilation is going to be when we bring air in from the atmosphere into our lungs and breathe air from our lungs back out to the atmosphere. So pulmonary ventilation is a two-part process. These are all of the steps in respiration, and they've all got a two-part process. So we'll look at each of them individually in just a minute. But we breathe in our air, and then we'll have alveolar gas exchange, where oxygen is going to move into the blood, CO2 is going to move into the alveoli. The third part of respiration is gas transport. We've got to get our blood containing our oxygen to our tissues. And then in our tissues, we have to have systemic gas exchange. So oxygen will enter the tissues, CO2 will enter the blood. Now we transport that oxygen or that CO2-rich blood back to the lungs. We have our gas exchange at the level of the lungs again, and then we can breathe that off to the atmosphere. So those are all of the steps in respiration, and we'll start by talking about pulmonary ventilation, which is a two-part process. So pulmonary ventilation is bringing our air in and out of the lungs. Again, this is a two-part process. The first part is inspiration, in which we inhale air. So inspiration is also known as inhalation. And expiration, which is also known as exhalation. So both of these are involved in pulmonary ventilation. And it's pressure changes in the lungs that are causing what's happening with pulmonary ventilation. So let's look at each. If we look at what's happening in inspiration, then we look at our lungs. Our lungs are sitting on our diaphragm. We said that the diaphragm is poking up into the base of the lungs. So what happens in inspiration, this is the only active part of respiration, of pulmonary ventilation. Why is that? Because what's happening during inspiration is that we are stimulating the diaphragm to contract. So as the diaphragm contracts, it's going to move down. It pushes down on all of your abdominal organs. It pushes out on your thorax a little bit, and that's going to increase the volume in our thoracic cavity. So as it contracts and drops, then it's increasing the volume of our thoracic cavity. So if we're increasing the volume, what are we doing to the pressure on the air in the lungs? We're decreasing the pressure. So this pressure in the lungs is called intrapulmonary pressure. And it's changing throughout pulmonary ventilation. The other pressure that's important to consider is atmospheric pressure. So atmospheric pressure is the pressure of all of the atmosphere on you. So it doesn't change. What's going to change is our intrapulmonary pressure. So as we increase the volume in our lungs, we decrease our intrapulmonary pressure. Atmospheric pressure will be greater than intrapulmonary pressure, and air will flow in. So when we decrease this pressure, atmospheric pressure will exceed intrapulmonary pressure, and air will move in. So we can say atmospheric pressure is greater than intrapulmonary. Pressure, and the result is air flows into your lungs. Why? Because one of our laws of physics is that gas moves from an area of high pressure to low pressure. So when we've increased the volume in our thorax, and we've decreased the pressure, our intrapulmonary pressure, atmospheric pressure will exceed it and air will flow in. The second part of pulmonary ventilation is expiration. Expiration is a passive process. It's passive because all that has to happen is the diaphragm relaxes. So if we look at our lungs, the diaphragm is going to relax and push up into them. As it pushes up into them, it decreases the volume. So what happens to our pressure? We're going to increase the pressure. So now, intrapulmonary pressure will be greater than atmospheric pressure, and air will flow out. So as we decrease the volume in the lungs, we increase the pressure on the air in the lungs. So intrapulmonary pressure will exceed atmospheric pressure, and air will flow out. So on a moment-to-moment basis, the diaphragm is your primary muscle of respiration. With forced inspiration or expiration, we can use our intercostal muscles to help with that. All right, then the next part of respiration is alveolar gas exchange. And if you look at the pressures that are acting in the system in our alveoli, this figure in your book is showing us that the air, all of our air has a bunch of different gases in it. So you can look at air and calculate what's the pressure of each different type of gas in that air. We call that a partial pressure. So if you look in the alveoli, before systemic gas exchange occurs, when you first breathe, or before alveolar gas exchange occurs, when you first breathe in air, This air in the alveolus has a high partial pressure of oxygen. We've got blood coming through here in the capillary. And if we look at the partial pressure of oxygen in the blood, it's only about 40 millimeters of mercury. In the lungs, the partial pressure of oxygen is at 104 millimeters of mercury. If we also look at the CO2 then, we can see in the blood there's a partial pressure of CO2 of about 45 millimeters of mercury. In the air in the alveoli, it's only 40 millimeters of mercury. So if our gases are following this law, that gas moves from an area of high pressure to an area of low pressure, we can look and say, okay, there's high pressure of oxygen in the air, low pressure in the blood. So oxygen is going to leave the alveoli and enter the blood. So before this gas exchange occurs, we look in the blood, there's a high partial pressure of CO2 relative to CO2 in the alveoli. So CO2 is going to enter the alveolus to be breathed off. And now when we are on the other side of capillary exchange, at the level of the alveoli, our air in our blood, the air in our alveolus and the blood in our body now have reached equilibrium, so that we've had gas exchange occur, and now the blood can exit the capillary, oxygen rich, and CO2 poor, relative to what it will be when it picks up CO2. Okay, so this is alveolar gas exchange, and again, it's pressure, the law of pressure, that gases want to move from high pressure to low pressure. So if we look, we're high pressure of oxygen in the alveolus, this blood coming in is low pressure, so oxygen is going to enter the blood. High pressure of CO2 in the capillary, low pressure of CO2 in the alveolus, so CO2 is going to leave the blood. And now after capillary exchange, our blood has reached equilibrium, our gas equilibrium with the air in the alveolus. Okay, so then we can look at systemic gas exchange. And if we've got our capillary flowing through here, and bringing blood in this way, out here, this would be our tissue. So our tissue cells, when our blood comes in, as it's going, it's dropping off oxygen along the way, so it's going to drop. By the time you get to a systemic capillary, you're going to be a little less pressure than you were in the lungs, but we're still higher pressure than the tissue. So if you look, when we come into the capillary bed, the partial pressure on oxygen is about 95 millimeters mercury. The partial pressure of oxygen in the tissue is about 40 millimeters mercury. The partial pressure of CO2 in the blood coming in is about 40 millimeters mercury, and in the tissue it's about 45 millimeters mercury. So both of our gases are going to follow our law of gases. Oxygen is going to move from high pressure to low pressure and enter the tissues. CO2 is going to move from high pressure to low pressure and enter the blood. So that now, after systemic gas exchange occurs, then our blood will reach equilibrium with what our tissue fluid was. So our gases move and are exchanged across the capillary bed. So that now the tissues will have oxygen, and now the blood has picked up that CO2 to bring back to the alveoli to be breathed off. So then the last part of respiration is gas transport. And for O2, most of it is transported on hemoglobin, but about 1.5% is floating free in the plasma. The other 98.5% is bound to the heme on hemoglobin. For CO2 is transported in the blood in 3 different ways. About 10% of it floating freely in plasma. About 20% bound to the globin on hemoglobin, and the remaining 70% is transported in the plasma as bicarbonate ion, which the chemical formula is HCO3-. And this is floating around in the plasma. This is not a chemistry class, this is not a physics class, so I'm not going to make you worry about the chemical equation that is guiding this, converting back and forth from CO2 to bicarbonate ion, but you can definitely read about it in your book if you're interested. So that's how each of our gases are being transported.